ways that we offer is fascia blasting. It's another form of myofascial release, just like cupping is. When you've gone through school, you may or may not have learned a lot about connective tissue. So fascia is a very specific type of connective tissue, or maybe it's the other way around. Connective tissue is a type of fascia. So we've got skin, fascia, fat, fascia, muscle, fascia, bone. So those are the layers. So every other layer in our body is connective tissue. We are one huge webbing of connective tissue. We would fall apart if we didn't have connective tissue. It is our second nervous system. And so when you have repetitive injury, repetitive motion or injury or scar tissue, or you're dehydrated, your connective tissue gets sticky and stuck. So you know that layer on the top of a chicken breast that's really slippery and slimy, that's connective tissue, okay? And so when those layers get sticky and stuck, you create adhesions and restrictions, and that compression sits on a nerve, which is where a lot of our nerve pain comes from. Two things cause nerve pain: compression from the sticky and stuckness, and inflammation. So whenever you have inflammation, you've got your metabolic waste, okay, from the inflammation, and that's what the nerve endings are sitting in, and so that's what irritates them. So that's why reducing your inflammation is so important with infrared therapy, and getting your fascia to be unsticky and stuck. So that's why we love using the tools here, cupping and fascia blasting. Please don't be afraid of this tool. It is a very effective way of very kindly letting that connective tissue release and breathe and open up again. So you will receive a massage from either myself or Bobby using this tool, so you can see what it feels like. And then we will train you in person so that you can have your hands on this tool. And I encourage you to get one and practice it on yourself. I actually use these tools in the shower every day. It's helped me grow my hair back. It's helping me with the lines on my face. Supposedly it helps with cellulite, but I haven't seen that yet. But I'm not probably consistent enough with it in order to see that difference. Fascia blasters, we have black ones, we have white ones. It doesn't really matter, it's just a color. I've named them. This is the baby, this is the mama, and this is the daddy. They're all effective in different parts of the body according to how large your person is and what area of the body you're working on. I love the baby massage or fascia blaster for the paraspinals, for up in the traps, the levator scapula, the scalenes, the back of the arms, the area where people can get the carpal tunnel. So you don't need to use a lot of pressure with this. Some people come in that have either had fascia blasting experience or have watched a video and think that you need to go really deep and really hard with this tool, and you do not. Our goal is not to cause pain. Our goal is to break up that fascia. So you want to use a fast and quick paced motion over the muscle. If a person is thinner in stature, you don't want to be going over the spinous processes, over the bone. Uncomfortable. Won't hurt them, but it just doesn't feel that great. So this baby is going to go up and down the paraspinals quickly. It's kind of like when you're filing your nails. It's very similar in action. You don't need to hold this tool very hard in your hand. It's really a very loose grip. Okay, so you're going to slow down when you're going to go a little bit deeper. I call this popping the wheelie. Because what you're doing is you're putting this blaster into the back part of your hand, and you're putting your pressure more on these tongs of the fascia blaster, and you're just kind of putting that pressure into the trapezius, the levator scapula. It's really a nice little meat tenderizer. This is a great tool to use before you really start your massage. You're going to get a deeper tissue, and it's a great way to save your hands. Always check in with your client. Sandra, is that pressure okay? Okay. So Bobby did cupping on Sandra. You don't want to do cupping and fascia blasting in the same area. You're going to overdo the connective tissue. Person's going to be rather uncomfortable. Okay. So Sandra, thank you for enduring us doing both of them on you today, but we're trying to be tender here. So this teres area is also a great area for people to get some shoulder work done. You don't want to use a lot of pressure in here at all. Also, the SI joint is another area, just going over that area back and forth. The one thing you do not want to do with this tool is go in circles. Do not, I repeat, do not go in circles with this tool. It will confuse your connective tissue completely. So you always want to go in with the muscle or cross fiber, okay? So that's the two methods that you want to use, okay? If you have a larger physique person on the table, which Sandra's not, so I'm just simulating here, this is a great tool for going all the way down and all the way up, all the way down. It's kind of like rolling dough, okay? I wouldn't want to use this tool on her back because she's thinner, she doesn't have a lot of bulk, but the bigger guys that we get in here, this is a fantastic tool to be using on their back. I like to use this up in the top shoulders and up into the traps, the levator scapula, and I take this tool and I just angle it so that you're getting a few of those tines in there and getting into the top of those traps. This is going to save your thumbs. And if you've been at it as long as Audra and I have been, and Bobby, you know your hands are your most precious tool and you don't want them to wear out sooner than you do. Okay. So when you're using this tool, you want to make sure that you take a little break. Okay. So you go in there a little bit, do a little bit of isolated work, and then do some effleurage. You always want to integrate and get the tissue that you have released and get it integrated and get it back into your lymph or your circulatory system so that it can exit the body through the liver or the kidneys. And the cupping, same thing with cupping. So this is myofascial release that's going to be, and some people are familiar with Grafton, but that's not within our scope of practice. That's something that physical therapists have been trained to do. All right, so that's the upper body. We'll take a break here and I'll be right back. Really tough area to stretch. If you're a runner or an athlete or, you know, just have really tight legs, this is a great tool to help break up that area. You want to make sure you've got plenty of oil on the skin when you're using the Fascia Blaster, otherwise it's going to be pinchy and people are not going to enjoy the sensation of that. Gals have a tendency to be a lot more tender along the side IT band here as it comes into the knee area, so just be tender. You don't want to be applying a ton of pressure. But the goal is to use more of a friction type of a motion, back and forth quickly. And what I'll do a lot of times, so people are more comfortable with this process, and if they're heavier set, I'll take and hold like the sheet down so they're less likely to move. So see the difference when I wasn't doing that? See how much her butt's moving? Now as I'm holding it down, it's just giving it less opportunity for it to jiggle around, and I just think the client will feel more comfortable when there's less of that going on. Okay, so the IT band, and then of course the calves are great. I personally love the feel of the smaller tines, so I'll use the smaller Fascia Blaster within the smaller areas of the body. If you have somebody that has plantar fasciitis, I've gotten people out of pain by using this. So you just want to be super gentle, and the person may be ticklish. Sorry, I didn't ask you, Sandra, I'm so sorry. Ask if your client is ticklish in their feet, okay? So you can just do compression and apply just pressure throughout the bottom of the foot. But if they're not ticklish, you can take these tines and go up into this plantar fascia and get that all broken up. The hard part about plantar fasciitis is we have to use our feet to walk. So it never gives that area a chance to heal. But I have found that consistent use of this tool gets people out of pain the fastest. And everyone's a little different with their plantar fasciitis. I haven't found one technique that's like universally the same for anybody. Have you?
No, I do like to use the cups on the back of the calves though for plantar fasciitis.
Mm-hmm.
Just a little side note. And usually I'll use like the medium sized one down to the smaller ones as the size of the calf allows. And that helps stretch out that area because it all comes down and wraps.
Absolutely.
So you can encompass, more things. And you could really do cupping on the calf and fascia blast the foot because you can't cup the foot.
Right.
So there's
Okay.
there's different methods you can use for that too. Yeah,
Yeah.
but no, there's no one size fits all.
So remember, after blasting, you're going to integrate and do some effleurage. And that's about it. So if people are having knee issues, a lot of times it's because everything's tight going into this junction, right? Tight hamstrings, tight IT, their adductors are tight. So I love using this tool in the shower myself. I've got knee issues, and so I use this in the shower, and it just feels great. Keeps all that connective tissue all loosened up. And if you're a consistent runner, this is like a tool that's almost like you shouldn't be living without it. It can keep you from having a lot of injury from just constantly be using your muscles and putting them to task. And then get this tool up and underneath your leg in your hamstring area and just go to town. Now, like I said, you don't need to use a lot of pressure on this. If people are bruising from using this tool, then they're using too much pressure. Period, end of sentence. It's not necessary. And then this is the one that I love to show our clients, and we can sell this tool to people. So don't be afraid to let people know about it. But if people are having low back issues and their SI joint's an issue, have them stand in the shower with the water beating down on their sacrum, and take this tool and just have them wiggle with it. Okay, they can go up as far as they can up their back, and then they can get down to that sacrum area, and they just have a little fun with it, right? Because it's not hard to just jiggle your hips and have that bar going over it all the time. Back and forth, back and forth. Feels great. I bet you loved that.